Fantastic. So excited to be here this evening. Thank you for inviting me. Just going to go straight into my slides, and there's so much information to share with you this evening. So forgive me if I'm speaking very fast, because that we will need time to have a conversation. I think it's important to remind ourselves the constitution of the NHS and why NHS was founded. And interestingly, it's going to be 75 years this year. So it was founded in 1948. And it was founded as an instrument of social justice, interestingly, to address and to care for everyone, regardless of where they are from, what they look like, their background, their social status. So we have that, as a backdrop of what should influence the care that we provide. But is that what the case is? And not forgetting that 1948, the NHS was actually, was put together by white people for white population, which is fair. But this is 21st century. The country is far more diverse than 1948. So is it time for us to start thinking, outside the box in terms of how we care for diverse communities? So why do we work to improve equity and equality? We do know equity is a key component of high quality care. It will also help us to achieve our half-it aim by the government to reduce maternal and perinatal mortality and brain injury rate by half by 2025. We are in 2023, and obviously we have made a good progress in relation to that. And it's also our legal duty to ensure that we provide cultural, equitable care, to the women that, are within our services. We have the NHS Constitution, like I already mentioned. We have Equality Act, as well as health and social care. So we all are aware very much so about the Embrace report. It's not new to many of us now. And it's been, this data has been collected for a couple of decades now, and it's important that we know how far we have come. And just before the recent report that was published in November 2022, the seventh one, which obviously the November one was the eighth one, I think it's important to know where we are coming from being 5 times more, to 4 times more. And it's also important that we celebrate, our small wins in terms of improvement. And we obviously, not forgetting the COVID, up to this stage, not forgetting other challenges. And COVID did not bring anything. We just shone the light. It just practically shine the light on the inequalities that's already existing in the system. So the 7th Embrace report at the time, which was 4 times more for Black women to die and twice more for Asian and mixed ethnic group, ethnicity women to die within our services. I refer to that as the same report, the same year, nothing has changed. And we're just talking about it year in, year out. Next slide, please. And it's not just about our mothers, it's also the babies of those women from, different communities. And as you know, in that same year that we had the 7th Embrace report, Embrace also came out with a combined impact or report that actually looked at the relationship between ethnicity, deprivation, and as well as age, which obviously I believe that was the first time they're looking into those combined reports. And I actually refer to that report as, triple whammy for ethnic minority communities, mothers, Asian, Black, and ethnic and mixed ethnicity mothers. Because if you look like me, if you're an ethnic minority and you also lived in the most deprived areas in the country, and you are younger or older, then your risk is very much higher. And also for the babies, they're also up to 4 times more likely to have stillbirth, and twice or over twice more likely for their babies to end in neonatal death. So going on from that, yes, we now have the most current report. Have we really moved? So it's actually a report that says, where are we now? And I want to believe that many of you have seen this report or you have read the report. So what does that say to us? So again, like I said, it's important that we acknowledge that there have been a lot of interventions, in addressing the inequalities, but we still, it's a journey. we still have a very long way to go. This report now showing 3.7 times more likely for Black women to die. But again, 3.7 is still very high. One death is far too many. And it's important that, yes, we should not be comfortable. Yes, we are improving. That not statistically significant. I think it's important to highlight that. And also to not be comfortable with that. Yes, there are a lot of interventions. We're talking about it, but are we moving at the pace that we really want to? Not just yet. So just the summary of what that report says. Like I said, currently there hasn't been no statistically significant increase in the overall maternal death rates in the UK. And also there's still, a huge increase of inequalities in maternal mortality rates, especially for Black and Asian women, and also women that live in the most deprived areas. And not forgetting also our postnatal, the causes of this death is very much around postnatal period. And again, I think it's something that we also need to focus on in terms of the postnatal care, both in the hospital and also in the community, and other agencies that we need to be working with clearly to address these issues. And I do know Tracy has talked about continuity of care, because again, it relates with having that relationship, not only with the woman, but also with professional groups that involved in the care of these women. So what do we really know? What do we currently know about the challenges that were ethnic minority mothers, Black, most especially those women that were identified in the Embrace report? What are the challenges? What are the barriers? We know, yes, they access the care late. Is that true? Do they know when they should access they should access our services? Is the information widely accepted, available for them in the community, or is it just sitting within our maternity services? We know, we are aware of all these challenges, and how are we addressing those challenges? And in addition to what we know, we also now know, following those 3 reports, and again, many of you would have seen already this report, which is hard to read, but we have a deep dive into an understanding into the experiences of our diverse communities that are using our services. We have the birthright report looking at various, ethnic groups. We have 5 times more fantastic 2 ladies looking at and hearing the voices of Black women specifically, and mixed ethnicity women. And also we have the faith, because it's not only about ethnicity, it's also about the faith. We heard from the Muslim women, and they all really, we heard clearly and loudly what this group of women and communities are telling us. So what do they want? What do they indicate that they want? Just in summary, because of time, they want healthcare professionals to stop making assumptions about the ethnicity as well as about the religion. Have conversation with them. Women want to be listened to. And it's quite interesting, because in terms of listening, it's not only, I think the listening bit really cuts across all ethnic groups. And it's important women don't feel heard regardless of their status and where they are from. But most importantly, the women from, diverse communities don't even feel heard, more. Women want more antenatal appointments, and they also want more information about their birthing options in the simple language that they understand. And finally, they wanted every procedure, including induction of labor, to be explained to them properly. So across those 3 reports, we have 5 key themes. There were actually 84 recommendations were made across the 3 reports. 29 were made by Birthright, 10 were made by 5 times more reports, and 45 were made by the Muslim Women's Network. So we brought all that into 5 key things. What were they all saying? They talk about the workforce, training and education to better address health inequalities within our services. The co-production, importantly, getting women in the center of their care. Continuity of care would address that for us. The data quality, improving coding of ethnic groups. There's a lot of work going on around that. Anti-racism approach. We do know we have systemic issues And we also have this conscious and unconscious bias from our healthcare professionals. And also, we also heard that, women from ethnic minority background don't necessarily complain. And raising awareness of complaint process is very important for us to be able to improve the care that we provide. And the CQC 2021 maternity survey published in February of 2022 actually alluded to that in terms of the responses that we received from our ethnic minorities. And you can see that for yourself. Moving swiftly, I think the next slide I'm going to jump because our lovely Tracy has already mentioned about the key outcomes and the benefits of continuity of carers. And I must say, actually, before I move from this slide, that we do know one of the causes for Black babies ending up in stillbirth is very much preterm. And we know that continuity of carer, reduces, if you are on the continuity of carer model, ethnic minority, 24% less likely to experience preterm birth. I mean, it's really a no-brainer, really. Whatever that works for me is evidence-based. Whatever that works to reduce, the inequalities is what we should do. So what are the three main approaches for midwifery continuity of care? Several targeted, culturally sensitive interventions have been developed and piloted to improve the access to and quality of maternity care for women from ethnic minority backgrounds and to address the increased risk they face when giving birth within our services. But so for this, we have enhanced care, which Tracy has mentioned briefly, peer support. We have evidences of that across the country. And the example of that is maternity maids, that they operate in East London. And that works very well with women as well. Tailored parent education, culturally sensitive education. We have that evidence that ethnic minorities do not attend antenatal classes. Is there a reason for that? So tailored parent education, telling them in the language that they understand and they are able to engage with. So finally, the respectful and inclusive maternity care, I think it's important to mention this because what midwifery continuity of care does is it enhances the culture of respectful maternity care. It helps you to listen to the woman. The woman is in the center of the care. She's not just in the center, she's in the control, of our care. And it also provides, actually makes a provision for culturally sensitive, safe and quality care. The woman feels safe because she knows she's in the control of the care that we provide. We are just a partner, in the care that we provide. And it's also evidence-based, like we've all mentioned today. And it's personalized, it's holistic. Midwifery continuity of care provides holistic care, for not just the woman, but for the family. And also it provides empathy, communication. It empowers both in the relationship to communicate appropriately. And it also provides confidence for the woman. And two is to the woman and to the family in terms of the care they will receive within our services and gives the healthcare professional the knowledge that is required to support the woman and her family. And finally, it also empowers the midwives as an advocate for women and for midwifery to provide that the care that is required to improve the outcomes of these women. Thank you very much. So I'm just